Have you ever thought about the paradox of bleeding, but without any actual blood to see? That is exactly what we are looking at today. We are unpacking the mechanics of internal bleeding, breaking down this invisible medical thread so it all makes perfect sense. Let's get right into it.
Okay, let's dive into this. When we think of bleeding, we almost always picture something completely obvious, right? A cut on your arm, a scraped knee, blood you can actually point to. But what happens when blood escapes from damaged vessels and has literally nowhere to go? Instead of leaving the body, it just secretly pools inside of you. You might not even know it's happening right away, and honestly, that hidden nature is exactly what makes it so incredibly dangerous.
So the medical definition of internal bleeding, or internal hemorrhage, is actually pretty straightforward. It's just blood escaping blood vessels and collecting inside the body. But here's the thing, the danger level isn't a one-size-fits-all kind of deal. How bad it is really depends on 4 key factors. First, where exactly is the bleeding happening? Second, how much blood are we talking about? Third, how fast is that blood leaking? And finally, is that escaped blood compressing a vital organ or depriving it of blood flow? A tiny bleed might just resolve completely on its own, but a major hemorrhage, that can quickly lead to shock, unconsciousness, and, well, even death.
Which brings us to Section 1, Danger in the Brain.
Think of the human skull as a completely rigid bone box. There is absolutely zero extra room in there. So if blood starts to accumulate, the pressure skyrockets. The blood has nowhere to go but inward, squeezing vital brain tissue. We usually see this play out in 2 distinct ways after a head injury. First, an epidural hematoma. This happens between the skull and the dura, which is the protective layer around your brain. And what's terrifying here is the speed. Symptoms can develop incredibly fast. Someone might seem totally fine right after hitting their head and then suddenly suffer a massive neurological crash. On the flip side, we have a subdural hematoma, which happens beneath that dura layer. This one is sneaky. It can develop incredibly slowly, over days or even weeks. In older adults or folks taking blood thinners, this slow bleed causes memory issues, personality changes, or just sleepiness that people often totally mistakenly write off as just aging.
And that contrast brilliantly sets up our next condition, often described by patients as literally the worst headache of my life. Now, this isn't just someone exaggerating a migraine. This is the classic textbook description of a subarachnoid hemorrhage. It happens when blood bursts into the space directly surrounding the brain. It hits like an explosive thunderclap that reaches maximum, agonizing intensity almost instantly. Let me be clear. If you or anyone you know ever describes a headache like this, especially if it comes with vomiting, neck stiffness, or light sensitivity, it is an absolute drop-everything medical emergency.
But sometimes, the blood doesn't just pool around the brain, it bursts directly into the brain tissue itself. This is called an intracerebral hemorrhage, and it's very strongly linked to high blood pressure. When this strikes, the neurological warning signs are completely unmistakable. We're talking sudden weakness, sudden facial drooping, speech problems, a severe headache, sudden loss of coordination, and profound confusion. And because that bleeding is actively destroying brain tissue as it expands, the exact symptoms you see will depend entirely on which specific part of the brain is under attack.
Let's move down the body to Section 2, Chest and Abdomen Emergencies.
Moving down from the head to the torso, the hidden blood here has a totally different but equally deadly mechanic. It can literally suffocate our vital organs. Inside the chest cavity, for instance, we face 2 massive threats. First up is a hemothorax. This is when blood fills the space right around the lungs, usually after a major trauma. As that blood pools, the lung gets completely squished. It just can't expand, leading to severe shortness of breath and chest pain. Then there's cardiac tamponade. This happens when blood collects in the sacs surrounding the heart. If enough blood gets trapped in there, it literally squeezes the heart so tight that the heart physically cannot fill up or pump blood out to the rest of the body. Both of these, absolute, immediate life or death emergencies.
Now, dropping down into the abdomen, we run into some massive, highly vascular organs. The liver, sitting on the upper right side, can bleed incredibly heavily if damaged, causing severe upper right abdominal pain. The spleen is another highly vulnerable one, tucked in the upper left, but what's truly fascinating about a ruptured spleen is a strange little quirk called Keir's sign. The pooling blood actually irritates the diaphragm, and because the diaphragm shares nerve pathways with the shoulder, the patient actually feels this intense referred pain all the way up in their left shoulder. How wild is that?
But what's really wild here is a space most people don't even know exists, the retroperitoneum. Basically, it's a hidden pocket tucked entirely behind the main abdominal cavity. It's home to your kidneys, the pancreas, and some very major blood vessels. Because it's buried so incredibly deep inside you, bleeding here, whether from a crash, a vascular issue, or even just blood-thinning meds, can stay completely hidden from the outside. Doctors almost always have to rely on advanced medical imaging just to figure out that a hemorrhage is actively happening in this secret little pocket.
All right, that brings us to Section 3, gastrointestinal and hidden bleeds.
You know, not all internal bleeding comes from a sudden, violent trauma like a car crash. A lot of times it happens from the inside out. Now, unlike a deep internal bleed where the blood gets trapped, gastrointestinal blood eventually leaves the body, which gives us some really vital visual clues. Look at the contrast here. Upper GI bleeding, so that's your esophagus, stomach, or small intestine, often triggered by things like peptic ulcers, that can actually present as vomit that looks exactly like dark coffee grounds, or as black, tarry stools called melena. Why? Because the blood has been partially digested. On the other hand, lower GI bleeding from the colon or rectum typically won't cause bloody vomit at all, and the blood in the stool, it'll appear as a much brighter red because it hasn't traveled through that whole digestive process.
Another profound internal bleeding emergency can occur during pregnancy. An ectopic pregnancy happens when a fertilized egg implants outside the uterus, usually right in a fallopian tube. The problem is, that tube simply isn't designed to expand the way a uterus does. If the growing pregnancy ruptures the tube, it triggers severe, sudden internal bleeding straight into the pelvis. The warning signs here are one-sided lower abdominal pain, dizziness, fainting, and yet, just like with the spleen, that referred pain in the tip of the shoulder. This requires urgent, immediate evaluation, no waiting around.
We also really have to talk about medications. Anticoagulants, which we commonly call blood thinners, things like warfarin, apixaban, or rivaroxaban, are absolutely life-saving. They prevent strokes and dangerous clots. But by doing their job and actively reducing the body's ability to clot, they inherently crank up the risk of bleeding. If you're on these meds, an internal bleed can start without any obvious external injury whatsoever. A severe headache, unexplained bruising, persistent stomach pain, or blood in your urine or stool, those are critical red flags telling you to seek medical advice right away.
Now for our final, absolutely crucial segment. Section 4, warning signs and action.
So how exactly does the body let us know it's in major trouble when we literally can't see the blood? Well, it triggers a step-by-step cascade. It's the sound of a body in crisis. When significant blood is lost, your body aggressively tries to compensate. Step 1, your heart starts beating faster to pump whatever blood is left. Step 2, your blood vessels constrict to keep your blood pressure up and force that blood to your most vital organs, like your brain and heart. But eventually, we hit Step 3, compensation fails. The body simply runs out of fluid volume. And that leads straight into Step 4, hemorrhagic shock, which is a completely fatal condition if it's not rapidly reversed.
To catch this before that deadly shock sets in, we absolutely must recognize the signs of circulatory stress. I like to group these critical warning signs into rhythmic clusters so they stick in your mind. First cluster, severe or worsening pain, dizziness or fainting, and a rapid heartbeat. Second cluster, pale, cool, or clammy skin, shortness of breath, and sudden confusion or unusual drowsiness. Guys, these aren't just random symptoms. They are the exact physical manifestations of your brain and your organs screaming out for the oxygen they are suddenly lacking.
When a patient in this state arrives at the hospital, doctors have a simultaneous dual goal. First, they have to hunt down that invisible bleed. They'll use rapid ultrasounds, comprehensive CT scans, and endoscopy to essentially see inside the body. Second, they have to actually fix it. And this is a crucial point. They don't just pump the patient full of IV fluids and blood transfusions. Simply replacing the lost blood isn't enough. They have to immediately stop the source of the leak. That might mean doing a highly specialized interventional radiology procedure to go in and block the vessel, or it might mean rushing the patient straight into the operating room for emergency surgery.
The absolute biggest takeaway here is this. Don't wait for visible blood. If someone goes through severe trauma, gets hit with a sudden thunderclap headache, or has inexplicable dizziness and weakness along with severe pain, their body might be bleeding internally. Just because there's nothing to see on the outside absolutely does not rule out a life-threatening medical emergency on the inside. It really makes you wonder, doesn't it? If the human body can hide a completely fatal hemorrhage right under our noses, what other invisible medical mysteries are happening inside us right now?